Hi, my name is Dr. Joel Collins, clinical haematologist, practice principal at the Iron Infusion Clinic. I wanted to talk today about iron deficiency in children. It's certainly like iron deficiency in women, it's a large and under-recognised and often under-treated issue for a variety of reasons. As our clinic's grown over the years, we're increasingly seeing larger numbers of referrals from our paediatric, that is child specialist colleagues, who are referring their patients to us for iron deficiency. We know that 1 in 5 of all children under the age of 10 are iron deficient. Quite possibly, some of this comes from maternal iron deficiency, that is women who are pregnant and had their iron deficiency run through pregnancy that possibly wasn't adequately managed, and as a result, the baby had low iron stores and was born. Children, interestingly, cope quite well with iron deficiency in a different way than adults. Adults will get iron deficiency and they'll often get very fatigued and tired. As we know, anybody with children knows, children have a lot of energy, can really overcome a lot of sort of illness and symptoms. Iron deficiency in children can come out in different ways. We certainly see poor sleep quality, often driven by restless sleep or restless legs. What was attributed to children getting growing pains in the past, a number of these children are probably just iron deficient. Children will, unlike adults, children and the elderly too, which we'll talk about at a different time, can actually lose their appetite and become quite picky eaters when they're iron deficient. Poor appetite and weight loss can be a feature of iron deficiency in children. We also see iron deficiency manifest in other ways in children, such as poor concentration, poor behaviour, poor coping skills, and difficulty coping with school tasks, and poor memory. Sometimes children will be flagged by teachers as being tired in class or finding it hard to focus, and in fact they may just be iron deficient. Interestingly, the lab reference ranges, just like the adult ones, are very much lag behind. Many labs will accept a ferritin, that is iron stores and iron studies of 10 micrograms per litre or less, as really being the only cutoff for iron deficiency in children. However, as I've said in my other videos, that adult males have ferritins between 1 and 200 micrograms per litre, and realistically, children need very good iron stores too. Children need to get taller. Adolescents, if they're female, go through puberty, get their first menstrual cycle, lose iron that way. Additionally, children who perhaps have extended breastfeeding, human breast milk is not particularly replete of iron, and these children may become iron deficient. Children who have a lot of cow's milk can also become iron deficient. Lastly, adolescent boys between the age of 15 and 18 get a growth spurt, and they can become iron deficient as well. Lastly, fixing iron deficiency in children is as problematic as it is in adults, fixing them with iron tablets and iron liquid. Children are not particularly fond of taking iron tablets or iron liquid. Once again, they get the same sort of side effects, 50% rate of constipation, GI upset, and also really just behavioural refusal of oral iron liquid. So in our clinic, we do routinely give iron infusions to children 2 years and above in the appropriate circumstances. As a newer phenomenon, we're seeing a lot of our developmental colleagues, that is our paediatric doctors and children mental health specialists, who are seeing children for attention deficit disorder, autistic spectrum disorder, who will often refer their children to us for iron before embarking upon drug therapy for these conditions, because we know that even though these disorders are complicated and have a number of different factors that drive them, which include developmental, genetic, and environmental, we know that assessing and fixing the iron deficiency rapidly can improve many of the symptoms associated with these behavioural disorders, which may then allow children to either not need drug therapy or make it easier to manage for our developmental paediatric specialists. So certainly there are a number of reasons for taking iron deficiency seriously in children, and once again, seeing children with iron deficiency is very much within the realm of what myself and my staff are used to seeing in the Iron Infusion Clinic.